Hello, hello. Welcome to Healthy Perspectives, a podcast that takes on current cultural and social issues through a clinical lens. Hello, hello. All right. For those of you who have been following us, thank you so much. All the likes and subscribes, very much appreciated. We have been bringing this to you for a very long time now, and we keep the costs down by doing most of this all by ourselves. So we definitely appreciate the likes and subscribes. Hopefully someday this will be helpful to more people, and you can help with that by sending it to your friends, family, and stuff like that. Today, we are bringing you one that you should be able to send to anybody and everybody, because it's a sensitive topic, which is kind of interesting. I don't know why it would be sensitive in some aspects, and in other aspects, it's clear why it's sensitive. But this podcast today is one of those podcasts that will, if you love somebody, they're going to learn something from this. And if you despise somebody, they're going to be triggered by the truth. It's going to drive them nuts. So you can send this to your friends, your enemies, and everybody in between. What we're going to be talking about today is healthcare for dummies. Cough, cough, you. Just in case you're a dummy. Now, I'm assuming most of my listeners, as it seems at least, are not dummies. But I also know that some of my listeners are dummies in this category. So I am going to try to help you out. Okay. Healthcare. We're going to go after this, but we're going to do it in a way today that is hopefully kind of interesting. So your tip of the day is it's okay to nerd out on things that should be common knowledge, because they often aren't. It's okay to nerd out on things that should be common knowledge, because they often aren't. Today, what I'm telling you is I'm going to nerd out a little bit on this healthcare, health insurance junk, because too many people know too little crap. Let me give you some definitions. This is gonna start it off with a bang. Healthcare. The actual definition, what it actually is, it's the act of taking money from as many people as possible. Simple as that. That is the current model of healthcare in the United States. Take as much money from as many people as possible. We have been trained to call it healthcare, but it in fact is all about money and, to a great extent, theft. Even the people that get into the profession are ignorant to this. Other mental health professionals like myself, other medical health professionals, your surgeons, your doctors, they often get into the profession thinking it's about helping people, only to find out that what it's actually about is stealing people's money. That's why a lot of people get into the profession to turn around and get out. They're like, oh my gosh, I have to steal people's money. Now, I put myself in that category. I play the insurance game because in order to feed my family, I have to play the insurance game. Do I like it? No, I don't. I would prefer to have a complete cash basis practice. If I could do that in my small little town, hands down, 100%, that's what I would be doing. You want to pay for my services? Come in, let's talk price, let's negotiate, let's figure it out, let's move forward. Boom, done. It's all over. It keeps my costs at the lowest. It allows me to benefit the client more. I can charge less to a cash pay client and still get by. Of course, because I have to play the insurance game, I have to charge everybody exactly the same. And the way we've figured out how to get around that to some degree, it's the only legal way to get around that is to offer a same day pay, which I can offer a same day pay at whatever discount I want. I could do it at 10%, 20%, 50%, 75%. Easy peasy. As long as they pay the same day, they get the discount. If they don't, they pay full price. The same as insurance companies would pay. Well, insurance companies will never pay the same day. So they'll never get the discount, even though it's offered to them. Plus, we have to negotiate with the insurance companies. We're already giving them a discount. All right. So I'll get into a little bit more of that. Most people want to help in the profession. But when they learn it's about money, they get real frustrated. I'm going to prove more of that a little bit later. All right. Healers. Definition of healers. People who want to help. Help is the key word. No matter what system they function in. I am a healer, so I want to help. The fact that I have to work with insurance companies and work like all these things in order to feed my family also, I'm going to do that not because I want to, but because I am driven to be a healer. That's super different than a lot of other professionals doing the same kind of work that I do, but they might be in it for other reasons. People who are healers, they don't call it a job. They call it a calling. It's what I'm supposed to do. It's more morally centered. Okay. Insurance, the definition of insurance. It was originally designed to diffuse risk. Okay. That was its original design. So insurance is companies today in 2026, companies designed to make profit under the mask of helping people. That's what it is today. Insurance is companies, right, designed to make profit. So why does the government want in it so badly? To make profit. Why? Because they've already stolen all of our Social Security money and other things like that. So now they need to make more profit somewhere else, which health insurance is one of the easiest places to grab profit. It's a theft ring. Okay. Government. Let's define government. Security oversight, rule of law oversight, designed to protect liberty, God-given rights. And when it comes to that security oversight, we're talking about military, police, emergency. So at the local, state, federal level. That's it. Where in there does it say that we should be our government should be involved in insurance? Nowhere. Where they try to pretend is under the protection of liberty. You have a God-given right to go to a doctor. Not true. And in our country, it's been a right to go to emergency care all along. All right. Hang with me. I know I just defined a bunch of things that are probably already triggering to people. Okay. There's 3 types of insurance. Stay with me. This flow is going to get pretty raw pretty quick. 3 types. I am going to relabel them to be more accurate, right? More accurate than what we pretend they are. Social or governmental insurance. That's what it is when we are subscribing to what they call Obamacare and getting subsidies. That is social, or that Medicare, Medicaid, okay? Same category. Social or governmental insurance. Premiums, deductibles, and copays they try to fold those in based on taxes. So if everybody pays into it, which was what Obamacare tried to do, everybody pays into it, the young and healthy, the old and healthy, the young and sick, the old and sick, if everybody pays into it, then everybody has access to quote unquote the same care. We're going to get into that in a minute. That is a flat out lie. All right. But whatever. All right. The whole idea there, just so you know, in the social governmental category is the wealthy save money because they no longer have to insure based on asset levels. It's insured based on the basic level. If we can't get the poor people into it and we can't subsidize them into it, well, then the wealthy people can't pay anymore. So it's designed for wealthy to save money. They can pay less to ensure greater levels of assets, which goes absolutely against the design of insurance. But okay, if that's what people want, you want to give your money to the wealthy already, fine, you be my guest. You vote for social and governmental insurance, your Medicare and Medicaid, which, by the way, are the most dysfunctional. I will get into that in a moment too. The second type is for profit. I relabeled that because that is not private insurance. Private insurance is a lie. All right, I'll explain that later, but I'm going to explain it right now. Here's the deal. There's only one type of private insurance, and that's the third, self-pay. That's private insurance. That's you getting all of the perks of tailoring it perfectly to you. Okay. So that's the third. So it's social, governmental, for profit, not private. It's designed for everything to be negotiated on both sides. In for profit, they negotiate with the provider and with their customer, which is the person paying the premium. So if you're paying the premium, you're the customer. If in the social governmental, the government is paying the premium, which they pay directly to the insurance companies, the government is the customer. You'll see why that matters in a minute. If you're paying for yourself, that's actual private pay. It's direct between you and your provider. A lot of people ignore that third one because they've bought into some lies that I will highlight here in a few minutes. But hang on. Let's go down the social governmental track. I'm going to break these down a little bit for you. Medicare, Medicaid. Okay, that's what we have right now for the social governmental track. The fee schedule is set by who? The government. Why does that matter? Because on the provider side, if it's a fee schedule that doesn't feed my family, what am I going to do? I'm not going to provide that service. In other words, the best healthcare could very easily disappear. It's not sufficient to feed my family. I'm not going to provide it. So what are the first things to go? Let's say you need a knee surgery. It might be one of the first things to go. Who knows? It's an optional healthcare provision. It is not a required. It might also shoulder surgery. These joint elements, they might be the first ones to go. The longest wait lines, the highest expenses, out of pocket. Maybe they just stop taking it altogether. They don't do them. It's going to be things like, let's see, mental health becomes expendable. It becomes we don't actually need it. Why? I don't know, because is it really necessary? Like, haven't people for thousands of years figured out how to navigate the world around them? I mean, seems kind of like an optional, not a medically necessary treatment. That's what they would determine, potentially. All right. Also down this social or governmental path, you have providers that will often claim they can't do things that they could actually do. That way they can justify not losing money. Okay. Clawbacks in this model, it's the government going after the providers. Now you might be like, well, fine, go after the providers. They're super rich anyway, right? Not in this model. They're not. In this model, they're not rich at all because they have to provide a care at a cost that they didn't set. So they can't make any deals with anybody. They can't negotiate with anybody. The fee was set. They provide the service or they don't. Those are their only options. And so when you get clawbacks are when the government comes in and they look at your paperwork and they go, wow, you met with a client and there's this one thing in here in the note that says in instead of on. A letter different. One letter says in instead of on. Well, there's no way to be in that particular scenario. That's an impossibility. So since you documented it incorrectly, and by the way, this is not an exaggeration, seen it happen. Since you've documented it incorrectly, we're going to request that you pay that back. No, you cannot fix it. You can't go in there and change that letter now. You needed to change it before we saw it. And since you didn't do that $110 that we sent you, we need that back. I'm sorry, but that's just the way it's going to be. And when they do clawbacks like that, a lot of times they're for completely ridiculous things like what I just described. And sometimes they're for good reasons. Okay, because that is how the government is going to quote unquote protect from fraud. But still, fraud is common because it's so paperwork heavy. And if you get people who know how to do the paperwork, then the government doesn't really look at, well, was that person a real person? Did they actually exist? Were they a made up person? Was the provider a real person? Did they just create an NPI, a national provider number, for somebody who didn't actually exist? Like, they don't look at all of that because, wow, this paperwork is amazing. Good job. You just made $1 million with fake paperwork that looked really, really good and real. Documentation is more important than the treatment in this model. Like it, don't like it. I'm not here to tell you what you want to hear. I'm here to give you the information. Documentation is more important in this model than treatment. If that's what you want, you're all for social and governmental healthcare. And it creates a two-tier system. Now, a lot of people have bought into this lie, which I'm going to tell you later, that it doesn't do that, but they're wrong. They are flat out wrong. It's a two-tier system. How does that work? People who have money and pay into the social governmental system, they can access the governmental care, Medicare and Medicaid, when it's convenient for them. When it's inconvenient for them, in other words, somebody says, hey, I don't do this service for anybody anymore because I can't make money on it. The government pays me, will pay me, $6,000, but the procedure costs me about 10 to 11,000 just to provide it. A person with money is going to go, well, how about I just pay the difference? Or what they'll do to be legal in this system instead is, how about I just pay for the whole thing? All right. So you've got another built-in spot for fraud, which is the provider will bill the government and get that amount and then take cash for the remainder, which is illegal. Or the provider will just say, I can't do that. And then the person who has extra money will be able to say, well, what if I just paid for it myself? Sure. You pay me $11,500. I will do the service for you. Done. Two-tier system. If you have money, you get better service. If you don't have money, you just can't access the care that you need. Sucks for you. Too bad, so sad. Okay. Next one, for profit. What we often hear called as private, which it's not. I've already covered that. It's not private. It's for profit. Don't mistake it for private. It is not private insurance. It is for profit insurance. Okay. They utilize the government fee schedule. And why do they do that? It sets competitive balance. So if the government fee schedule says we'll pay out $10,000 for this particular treatment, they'll set their fee schedule right around that mark. Sometimes they'll bump it up just a little bit to give themselves a competitive advantage and draw people away from the Medicare, Medicaid model into their premiums. Okay. But it's still just a money grab. They negotiate with providers and customers. That's where they make their money. They make their money in the negotiating process. If they can get the provider to take less, they make more. If they can get the customer, the person paying premiums and deductibles, to pay more, they make more. The big advantage there is the customer, the one who's paying the premiums, is actually a customer. So the insurance company wants to be careful not to piss them off too much and make them go away. So there's a little bit of a customer service orientation built into the cake. However, they still try not to pay when possible. Why do they do that? Because even though you're the customer, their whole model is based on making profit. They make money. They make money when you pay into them more and you take out less. It's that simple. If you pay in more, you take out less, they win. That's the model they're going for. The cool part is it can, to some degree, because there's a lot of government regulations on them at this point, ever since Obamacare, there's more government regulations on them. And it still remains true that your insurance can be tailored to you a little bit better. In other words, if you want to have a slightly higher catastrophic care model, you can get something that's a little more catastrophic care modeled. Meaning, I want a big deductible, $10,000. It's primarily to cover me if I'm going to a hospital. Outside of that, I'm just going to tell people I'm a cash pay. I'm just going to pay for my own care. So you keep your premiums really, really low. But if you were hospitalized for a length of time and you were out of work for a length of time, you pay your $10,000 or whatever, and the coverage is pretty good. So you can still do some level of catastrophic care, even though it's been super limited by the social governmental model with Medicare and Medicaid and the Obamacare requirements. Okay, but it's still there. You can still tailor it a bit. All right. They are motivated to keep fraud low to improve profits. So fraud in the for-profit sector, not to be mistaken as private insurance, because that's a load of garbage. We've already talked about that a few times. They are motivated to improve profits. Therefore, keeping fraud down is a big motivator. If they're spending $1 million and it's determined that it's a fraudulent $1 million, they just lost $1 million in profit. And it's easier for them because they are negotiating with the providers who have to prove who they are in lots of ways. It's a pain in the rear for providers. And then they negotiate fees between the provider and their customers. So they do the negotiating for the people. Okay. So the people don't have to negotiate themselves. All right. If they negotiate terrible terms, they don't get providers. It's that simple. Providers are like, nah, I'm not going to work with you. I did that with Cigna. Cigna wanted to try to pay me less than I could make at Taco Bell for a master level, clinically trained mental health professional. And that is not a joke. They sent me a check for $16. I tried to work with them to say, hey, wait a minute, this isn't right. This is not how it's supposed to go. They said, well, maybe we can get it up to 20. I was like, yeah, I can make more at Taco Bell. I sent them a letter and said, I'm out. And, they made me do a waiting period. And then I've been out of network with them. I will not go back to Cigna because they negotiated great benefits for themselves, but it would not feed my family. So I got out. And now Cigna in my town basically is non-existent because all the providers were like, what? No, we can't work for that. We can't feed our families on that with the overhead that we have. We've spent money, we got debt in college, or we've got, all these other expenses that we're paying for, office space or whatever. We can't do that, right? We got overhead we've got to cover. So they lost. They negotiated really, really strong and stupidly. Okay. That's how it works. They also negotiate the other side in the model of for profit. They negotiate with the person, their customer, to say, hey, if you'll pay us 15,000 a year instead of 12, we'll take your deductible from $3,000 down to $500. We'll make the money in the premium instead of the deductible. And what that does is it guarantees their money. And they like that. They prefer that because it's guaranteed. It's coming out of your check every month or whatever, and it's guaranteed money for them. That's a safety security piece. They know it's coming. Period. The end of the story. Whereas the deductible, if you don't go get services, you don't pay the deductible. So if you have a healthy year, you can go for the lowest premium, the highest deductible, and it won't matter. So they like playing that game. That's part of their negotiation process. Another thing in the for-profit category, documentation is important, but it's most important in the most difficult or costly situations. But it's minimally necessary in common scenarios. Now, the good thing about that is it's more efficient for providers. So providers like that. Hey, if I've got common issues, I'm going to do a more common note. It's going to be a much less extensive, simpler note. Literally, in many cases, called a simple note. It's efficient. And it's enough for the provider to know what happened without spending too much time and energy on paperwork that isn't necessary. Now, in the more difficult situations, the extensive paperwork is still going to be necessary for medical necessity, for later recall should something, in the more difficult situations, say heart surgery, if something goes wrong, you got to have extensive note taking, stuff like that. But that's a big advantage for a provider. We can save, in some cases, as a mental health professional, I would say for Medicare and Medicaid, typical notes going to take me about 10 to 15 minutes because I have to be more extensive, even in the most common scenarios. But with a for-profit insurance company, I can do that same note, simple note, covering what I need for memory recall, not what they need for proof. And I could do the note in probably 4 or 5 minutes, saving me half the paperwork time at the end of a day. That's 45 minutes, maybe. That's a major advantage for a provider. Negotiating, the last one is negotiating can tailor it to the needs instead of exacerbating the two-tier system. It's a lot closer to an individualized care model, but it's not quite the same yet. All right, let's go to the self-pay or private model. Okay, in this model, there's some things we're going to get to later on of why people choose them. In this model, I'm just going to be abundantly clear. This is the best model for most people, and it's the least used by most people. It doesn't mean it's the right model for everybody, but it's the best model for most people, and people don't do it. Let me tell you why it's the best model for most people. The fee can be negotiated between you and the provider. So if you go in and you want, say, a surgery done, and they're like, well, it's going to cost, if you pay the same day, we'll take 60% off. That just recently happened with my Achilles. Instead of paying like almost $9,000, it's going to be around $4,500. I could say, here's the thing. That's a little steep for me. Can we do 3,800? And if they look at their numbers and they say, yeah, we can make that work. Guess what? I pay 3,800. Done. It's negotiated. They say, no, I'm sorry, but that we can't negotiate below that because that's already our lowest one with still making sure everybody gets paid, including the rental of the surgical space and all of the things. And then I just decide, do I want to pay the 43 or do I want to negotiate again and see if I can get it down to, 41 or 40, right? 4,000. Okay. So that negotiation happens right there. It's between you and them. Nobody else is involved. That's it. It's that simple. You can also, by eliminating the middleman, you could go to the best care that you have in your area and negotiate with them. Maybe you get the best surgeon at a reasonable price because you just negotiated directly with them. Normally they're like, oh no, we don't make deals for anybody because he is the best surgeon that you're going to find in the area. And you say, can you talk to him or her and just say, hey, like this guy really wants it to be you because he knows you're the best, but he can only pay, 7,000 instead of, 9,000. Would you be willing to take them on if they pay at the same day of care? And they'll most likely say, yeah, I'll do that. I'll do that because that's guaranteed money in the bank. They still made some profit, not as much as maybe they want to make. But if they have space in their schedule, they're going to be like, yeah, fill it up. I'll take that money all day long. All right. Another part of the self-pay private is it eliminates thieves in the middle. There is nobody in the middle. It's direct to the provider from the customer. It's 100% tailored to the individual need. Nobody tells you, well, you can't go to that naturopath because that's not covered under your plan. You just go to them and just say, hey, I would like a naturopathic opinion on this situation. I'll pay with cash. Great. Cash pay price is this. Can I pay 10% off of that or 20% off of that? Sure. Yeah, we'll take that. Fraud is nearly impossible in this model. It's nearly impossible. The only fraud that could exist is if you paid for a service and then didn't get it. And that would be a provider who is fraudulent. And that's reportable because they're all licensed still. They report to boards. You just report that. That person's going to go out of business. That's simple. Very simple. So fraud is nearly impossible in this model. Documentation is completely secondary to the best care. Do they still document? Do we still document? Would I still document? Yes. But it's secondary. It means it's going to get done, but it's going to be a simple note pretty much every time. Unless something really weird comes up or if you stopped paying. Because then I want to be able to have that backed up. Okay. So that was the documentation. The next one, elevated risk if the most expensive treatments become necessary. In the self-pay model, if you end up with one of those diagnoses, your cancer, your heart disease, something that is extensive, which by the way, is even though the numbers are higher now than they've ever been, the chances are still less than 50-50 for those things. Now, I'm not saying you want to take that risk. It depends on how many assets you've got to protect. But should a major, most expensive treatment become necessary, you may not have the money for it. Of course, if that happens and you're under Medicare and Medicaid, you're going to get the lowest level of care that is medically necessary because that's how they save money. Meaning they're going to try not to do the expensive treatments. They're going to try not to do, in some cases, the right treatments. But hey, you want that model, you could go for that model. That is eliminated by early intervention. If you are disciplined, and I'm going to probably highlight this again later because some things need to be repeated. If you are disciplined and you start saving money as if you're paying for insurance, into an account that is a medical account, an account you only use for medical care, From the time you're 18, 17, 18, when you start working, if you put that into an account and you do not touch it unless you need medical care, chances are by the time you ended up with a cancer or a heart disease diagnosis and you need those really expensive treatments and you go to the providers and you say, I'm paying with cash, you probably have hundreds of thousands of dollars. And I'm not exaggerating. Look at the data. Heart disease it increases in risk as we age. You could have been paying into your own self-pay healthcare account for 25 years before you really need anything that's extensive. Do the math. If you invest that into, say, a typical investment portfolio, you're getting 10% per year, plus you're contributing every month. And by the time you're there, you're literally talking, you might have closer to $1 million in there. Meaning you still wouldn't need insurance. And you'd go to the providers and say, I'm paying with cash. How much does it cost? They say, well, this treatment's going to be $80,000. And you say, if I'm paying in cash and I pay up front, how much can you do it for? They go, well, gosh, probably $60,000. Great. Let's go. I'm going to get the best care at the best price. Game on. Plus, in the self-pay model, it's asset protection determines the level of protection you would need. In other words, the level of investment. If you have no assets when you're 17 and 18, so you only contribute $100 a month. As you develop assets, you buy a car, you might start contributing $200 a month to your healthcare package. Because why? If you end up sick and you've got to still make that payment, you don't want to have a whole bunch of money coming out of your paycheck to pay for the healthcare that you need. And so it goes. All right. So I'm going to get into the lies. So hang tight. This part, I know I'm nerding out on you. Just bear with me. I'm telling you, this is something everybody needs to know. Lie number one, you have to have insurance when you're young, healthy, and poor. False. That is a lie. But too many people believe that's true. It is a lie. You do not have to have insurance when you're young, healthy, and poor. A matter of fact, that keeps you young, healthy, and poor, and will turn you into middle-aged, healthy, and poor, and then old, healthy, and poor, or old, unhealthy, and poor. It keeps you poor. That's the only part of that equation that stays the same. The rest can change. So if you're young, you should not be paying so much. That's how the government model, the social model works. They make young people paying more than they will ever need. And they take that and they invest that and they make money on that. Or the way the government works, they take that and then they pay for Social Security because they already stole that. And then when you need it for your healthcare, they don't have that. So they changed the fee schedule. And now you have crappy health insurance and long wait lines. Okay. The lie is you have to have insurance when you're young, healthy, and poor. That is a lie. Number two, if you don't buy health insurance, you're surely going to die or go bankrupt. Wow. Get a little bit dramatic, would you? But that's what you've been taught. Even if you're my smart listeners, you have been taught that if you don't have health insurance, you're surely going to die or go bankrupt. When in reality, that's false. I'm going to prove it to you in a minute. The third lie is healthcare should be the same for everyone. a lollipop for you and a lollipop for you and a lollipop for you. And oh, wait, Adderall for you and Adderall for you and Adderall for you. And oh, you came in and you were having you had a skin issue. Heart transplant for you, heart transplant for you, heart transplant for you. I had a skin problem. I don't need a heart transplant. Heart transplant for you anyway. Same for everybody. You get what everybody else gets. Yay. Dude, what a lie that is. You go to the social governmental model, you can't tailor anything to your actual situation. Sounds pretty dumb to me. That would be a lie. So let's go over why we choose the different models. This is going to highlight some things. This is going to be real uncomfortable for some of you because you've bought into lies, frankly. Social governmental model. Why we would choose that. One, we're afraid to negotiate. Some people, they're just afraid to negotiate. And so they're like, I want somebody else to do that for me. Okay. They buy the lies that I just went over. They buy them all. And so they're like, oh, government, 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 help. In other words, you're already the victim. You're already the needy. So have somebody else come in and do it for you. Somebody who, quote unquote, knows better. Yeah, that's funny. You believe that shared cost benefits you. That if you're in the pool with everybody else, when you need to get some, you're going to have access to what you need. And this is far from reality. I told you I was going to prove this point earlier. 5% of expenditures on all insurance in the United States, about 5% of expenditures are going to the people. How do I say this? At the top, as I was. Hold on. Let me reframe this. I'm doing a terrible job right here. Hold on. Let me reframe this in a way that makes sense. Of all the money collected, 95% of the expenditures go to the top 5% of the people who are in need. 95 of the expenditures going out. So let's paint that. 100 people buy insurance in the governmental model, right? They pay taxes, they get in, boom. 5% of them are going to benefit with all the expenditures. 5 people out of the 100 are going to benefit from that model. 5 of them. 50% of them, 50 of those that are insured will account for less than 3% of all expenditures. Meaning 50% of the people take basically nothing out of the pool. 3% is all they take out. They put in the same, but they only take out 3%. The bottom 50%. In other words, those 50%, probably closer to 75%, but those 50% for sure paid unnecessary expenditures in their premium, in their taxes. What? 50%. That's 1 out of every 2 people you pass. One of them is overpaying. And only 1 out of 20 people you walk by is actually benefiting from the model. 1 out of 20. 1 out of 20. 5%. What in the actual heck? The top 1% of people who the model spends money on takes 20 to 25% of the entire pool. The top 1%. Do the math. That's bad math. That is bad math. It means you are getting screwed in that model. But if you want to choose that, understand everybody is going to be paying for that probably top 5%. And the rest of you are losing money. 95% of you are losing money. They're stealing it from you to give it to somebody else. Now, in a perfect world, I would want to help take care of those people anyway, because I'm a healer. But as a provider, I'd rather do that directly. I do pro bono in my office. I routinely have 1 or 2 clients at a time who do not pay me anything for my services. I provide them the same high quality service for nothing because I want to help. If I were a surgeon, I would do the same thing. I would take on a pro bono case. If somebody came in and they did not have the ability to pay, but let's say my heart went out to them. Like, I quickly learned that they've had a tough go. And I can give them a start, an advantage that they didn't otherwise have. I would look for those opportunities. I wouldn't do it all the time because I still got to feed my family, but I'd do it. In a private pay meaning not private insurance that they tell you, but in a private pay situation, then the negotiating between the provider and the client themselves, that's a possibility. But in the social governmental, it's not. Why would you choose the for-profit model? You're afraid to negotiate. Same as in the social governmental. You believe somebody else is more of an expert than you are. You want the shared cost to protect assets, right? I got some assets I want to protect. And so I'm going to have a little bit of that. I'm going to dip my toes in a little bit of that for-profit insurance because then I can protect those assets a little bit better. I can get a little more tailored care than I would in the social governmental model, which is good because I really do want to be in charge of my medical care. I don't want somebody else to be in charge of my medical care. So I'm going to go with that for-profit model because then I can tailor it a little bit to me. And I am somebody who doesn't like fraud. And so I'm going to get away from the governmental model where there's rampant fraud because the documentation matters more than the care. And so I just want to help keep that down, making sure that I maximize my benefit and minimize my costs. Okay. While still getting into the pool and having access to some of the care that I might need later on. Okay. That's the people who are going to go for the for-profit model. In other words, they got to have assets to protect. They want a little bit of ability to negotiate, at least with as a customer. Okay. The private pay. Play the odds. That's what they're doing. The private pay clients are going to play the odds that they're in the 95% that will save money if they do it on their own. They're just playing the odds. It is also for people who are really good with money because they will privately save for medical care, a broken arm, a broken finger, an MRI, whatever. They will privately save, and then they will dip into that pool only for medical reasons. Meaning within a couple of years of staying healthy, they are riding the wave. They're looking at their account going, wow, I would have paid, $6,000 in insurance. I got $6,000 in that account and it's growing. I'm investing it, so it's growing. The next year, they have a medical cost. It costs them $1,000. That six becomes five, but they keep investing at the level that they have. They recover that thousand plus what has been there is sitting there is making money. They spent $1,000, but now they're up to $7,000. How does that happen? Growth over time. That's money, people. That's private pay people. They realize that their investment in themselves can be more valuable than having somebody else keep their money and keep it for profit or share it with other people. It also sets them up to help other people. Because, if I pay somebody else's medical expenses, like one of my kids, and I take it out of that account, I get to deduct that as a medical expense. I'm helping somebody else. I can be more helpful than the government will, than the for-profit will. The negotiations don't scare them. They don't mind negotiating. They don't mind negotiating under distress a little bit because, it's when you're injured that you're going to have to negotiate. Wow, I blew out my knee and now I've got to negotiate. It just means you got to be willing to go to multiple providers and say, hey, what's the best deal you can give me if I pay in cash up front? And one provider says, well, the best I can do is 13 grand. The next one says, well, the best I can do is 16 grand. And the next one says, the best I can do is 12 grand. And you look at the provider and their level of care and you say, well, this particular situation is worth 16 grand because that provider is the best. And then I go back to them and I say, hey, look, I don't want to be too hard on this situation, but I did get an offer to do 13 grand over here. If you can come down to 14.5, I'm going to go with you because you're the better provider. That's hard to do when we're when we're in the stressful situation of we're injured. But if we're willing to do it, there you go. That's a private pay person. They're more disciplined with money. Like I said earlier, they save as if they're buying insurance, but then they don't, and it builds. They tailor their care directly to what they want. If they want acupuncture, they'll pay for acupuncture. Whereas some insurances won't pay anything for acupuncture at all. Or chiropractic care is limited or whatever, fill in the blank. They want to tailor their care. That's a private pay person, private themselves. Paying for themselves, not paying for a private insurance, which is what they call it when it's really for-profit insurance. Get these words changed. It's faster. I literally, on my Achilles, I know, look at that word, literally. I said it multiple times, literally. I skipped steps. I knew I was going to need an MRI. I avoided the ultrasound and the x-ray and all the things because I knew we were going to need an MRI. I'm not dumb. I'm like, they're going to get to the level of MRI. Why would we do all these other steps? Saving the medical world a bunch of time and energy that somebody else could benefit from. I didn't tie up the x-ray machine. I didn't tie up the doctor reading the x-ray. I just went straight to the MRI, came back, and they went, oh, it's kind of what we all thought it was anyway. And so, yeah, you're going to need surgery. You can get this MRI image directly to your provider for the surgery. I skipped so many things. Private pay, negotiated fees. Simple. By the way, private pay, you can often set a negotiated monthly fee if you end up with a situation. I heard recently about somebody whose grandfather had to have a major medical expense. They paid privately and they got the treatment. And, in this particular situation, they did it through the hospital. The hospital set up a payment system. They paid $20 a month until they died. And then the rest of it was forgiven. Can't collect from a dead person. That debt can't be passed on to others. Not legally. So that happened. But hey, Just factual information for you on the side. The private pay people will also view most assets as expendable in a crisis. That there are more important things than houses, properties, cars, your TVs and stuff like that. And they figure in a crisis, if I have to sell all of these things to pay for my wife's care, so be it. It's what it's going to be. I'm going to do it. Does that make sense? That's a private pay person. So now you're at the hard part. Which model do you think is better? Which model do you think is better for an entire culture? Yes, private pay is going to depend on the generosity of others, but people don't get into the medical or mental health world because they hate people. And if they do, they don't stay in it long. These are people who will want to work with you, who will want to negotiate reasonably with you. And if they don't, you move on to the next person. Which model do you think is best for a culture? You have to decide that, folks. We are coming up on a pivotal time where being informed about health insurance, insuring health, which by the way is a lie in itself. You can't insure your health. You have to decide what you're going to stand for. You. Don't be an idiot. Remember our tip of the day. For some of you, you already remember it. For some of you, I'm going to remind you. It's okay to nerd out on things that should be common knowledge because they often aren't. We just spent a bunch of time nerding out on health insurance and health care, when in all reality, oftentimes they are misinterpreted. I want you to be smarter. I want you to have a better chance. Folks, share this with people. Help people learn. It's healthcare for dummies. Because most of you have bought into one or multiple of the lies. That is why I did this podcast. You have to have insurance when you're young, healthy, and poor. False. If you don't buy health insurance, you're surely going to die or go bankrupt. False. Some might, but it is very, very rare. And given the right people around them, even those ones will get taken care of. You just got to find them. And in the mental health and the medical health world, people get into it because they love to help people. So you're going to find them if you look for them. And the other lie, healthcare should be the same for everyone. False. It should be tailored to you. You don't need a heart transplant. You don't need Adderall. You don't need whatever they tell you you need. What you need is a care that looks at you as a whole person and says, how can we manage your unique situation? Thank you so much for listening. Please like, subscribe, share this, get this word out there, and you have a wonderful day. Hey, everybody. Thanks for listening. We appreciate our audience a lot, so we give you some simple ways to track us down. Please like, subscribe, and follow all the podcasts on different platforms, but you can also email us at healthyperspectives@protonmail.com, or you can check out our website at healthy-perspectives.com/podcast. It's a backward slash. So if you want to go to our landing page, if you go to healthy-perspectives.com, you'll still find us. You just got to click on the podcast button. Thank you so much.